we want to increase our surgery numbers to 900 per year. How to do that? Okay, how much we can, how much can we put our budget for digital marketing as a general surgeon? What are the facets where we can do branding and promoting our hospital? Okay, so Dr. Pranav,
Prafulla ma'am, yeah, Prafulla ma'am is there. If you're there, you can just raise your hand.
Raise your hand. Yeah. So we can start with the how to increase the want to increase surgery number. That means you want to increase your leads. Okay. You can't make anybody to go through surgery. So the people who are already needing surgery should come to you. That is the your question. Correct. So what you should be doing for that?
See, once again, I'll tell you, this is not the right approach. Surgery numbers 900. You should see these many patients, and out of that, how many patients are going to be operated is going to be a clinical decision. The patient might not always require a surgery. So if you will aim in the way of doing 900, maybe some of the not required surgeries you will do. See, your aim should be seeing X number of patients properly, and X number of patients should get the right treatment. And there can be a revenue figure. I don't mind that you can say, I want to earn 10 lakh rupees. And then for that, there are avenues of doing it again. You can sell other things. I mean, see, it is not that I have to cut open 900 patients in a year so that I reach to this income. So this, the whole approach is faulty, right? So that point I want to take it across. I will say that you increase your numbers to more than 1,000. I don't mind, but not calculate the surgery numbers, calculate the number of patients, and calculate the number of
revenue. You should focus on revenue.
You should have happy patients going home and who are fit and fine after your intervention.
Correct. That is the whole way of doing business. Okay, this healthcare business is a different kind of business. Okay, this has to be ethical, otherwise it will be not a long-term thing, and it will come back and pinch you somewhere. Some people, so many doctors get this this thing now. They have a bad experience with patient. People were fighting, or they have thrown stones, or they broke something in their setup. Whole negativity someday it comes back, right? So you please do that. Try to understand, you already are very successful people, having a little 1 lakh 2 lakh rupees come here, less here and more there, it doesn't make any difference. The problem that what Dr. Pranav has said, the mindset should be on focusing on how I can make them happy, so that I get a lot of referrals. I get a lot of people who knows that my services are good, and then slowly you build a brand. Building a brand takes a time, and leads only come with a brand building. Try to understand, which we have already told in the academy, that your brand has to be very strong. And who will drive the brand? Your personal brand. That is why we told that you should have your own website. So whenever you do a good thing with patient and whatever happen in your hospital, you can post it on your website. Start circulating that blog or that information over your social media. Again, amplify in a digital domain. That is how you can brand build, right? And it takes conscious effort. There is no shortcut to it. No digital agency can do it. Try to understand, whatever amount of money you can spend on paid campaign, nothing will happen. Okay, so this will happen only with your effort and with the right intention. Your intention, your purity in thought is what will bring you a lot of accolades.